Arun, you have an excellent title for this conversation. You are Global Healthcare Transformation Director. Tell me a little bit about your role. What transformations do you oversee? What's your remit as Transformation Officer?
Sure. So I obviously work for Bupa. We're a massive international healthcare organisation undertaking lots of transformation at the moment, as many industries and organisations are. Where do I start? So we have, after the pandemic, obviously, as cliche as it sounds, undertaken a lot of different types of projects, which has been a bit of a catalyst for us. Mm-hmm. If we rewind back to 2020, the way in which our consumers and customers wanted to receive their healthcare has dramatically changed. If I give you a little example, in our Spanish business, our virtual consultations, for example, started off with about 500 or so a day pre-pandemic, and now are at 5,000. So we do, in that country alone, do 5,000. So what I'm trying to illustrate here is that people want to take and receive their healthcare in different ways. We want to meet those needs, and so the transformation projects that we oversee in the company are spreading between digital all the way through to operational, through to how we can provide that to them on a day-to-day basis.
Before we carry on, I just want to remind all of you to please send in your questions. We do want to make this session as interactive as possible, so you do have the QR code. Keep sending in your questions. So as you said, you are in the middle of a significant transformation. I think many of us know Bupa as a healthcare insurance company. What are you trying to change to? What's the goal here?
So you're right. I mean, in terms of in different countries, people know us as an insurer, but actually what might not be known to people is that we have hospitals, healthcare clinics, remote services, lots of different types of healthcare provision as well. So actually, I would say we're a healthcare partner. That still remains, and we aim to kind of lengthen and go more extensive into that remit. And so what we're trying to do is to be a partner to an individual or a customer or a patient, or however you refer to them, all the way from when, perhaps even before they have a healthcare issue itself. So taking us all the way upstream, preventing disease, making it more personalised, more bespoke. And our transformation projects that we're undertaking are trying to make sure that people don't get ill in the first place.
How do you do that? How do you get involved with the person's healthcare journey even before they're diagnosed with something?
Yeah. So I mean, we've heard a lot about artificial intelligence today.
Yeah.
I can give you a use case in which we've started to use it, again, in our Spanish business. We actually have something called AI-powered mental health therapy now. So coupled with using wearable devices, for example, making sure that we can receive information about how patients are sleeping, how they're exercising, for example, acting in advance to predict when they might have an episode of low mood, then providing them with personalised therapy that prevents them getting into a period of unsettled mood disturbance. And that's actually now shown to reduce the need for a mental health therapist or counsellor. And obviously in a day and age where we have workforce crises in healthcare across the world, that's really, really useful.
Was it the pandemic that triggered this transformation at Bupa, or just walk us through the decision-making, why you all decided to take a much broader approach?
So I think the pandemic definitely helped.
Accelerated it.
It did, yes. It changed our attitude towards risk. If you think about before, I think we were, we had a lot of governance, rightly so. We're a healthcare organisation. We need to be trusted by our customers. But during the pandemic, when we needed to adapt to delivering our healthcare in different ways, we moved towards providing solutions that were quicker and more convenient to our customers, and that kind of thread has continued all the way through.
But wait, had you started thinking about this transformation even before?
Yeah, I think we had started thinking about it, but it had definitely augmented that transition.
So let's take a step back from Bupa for a moment and just look at the wider healthcare industry. Of course, the pandemic played a huge part in the healthcare industry. I mean, we pretty much saw traditional healthcare models being turned upside down. At this point, what would you say the biggest challenge the healthcare industry faces?
So lots of challenges. If I give you a couple that come to the top of my head, I think we've got an aging population, and that's kind of virtuous of the fact that healthcare is improving. So we've got a lot of people getting older with chronic, complex conditions that need managing. And again, I think that's why it's so important to move healthcare upstream into a preventative fashion to prevent more chronic disease coming to the fore. So that's one thing. I think another challenge is that the way in which people want to receive it, like I said earlier, has changed. If you look at all other industries, look at media, look at finance, and we heard that earlier, people want to use apps, people want to get that information asynchronously, and I think healthcare has been a bit of a laggard industry in that respect. So that's the second thing. And I think that people want it personalised to them. And so that's the third challenge, I think, again, mirroring other organisations and industries that are kind of healthcare is a couple of years behind in that.
Speaking of personalized services, there's a great question from the audience. Is Bupa using AI to improve patient experience in any way?
Yeah. So we use the early stages of using AI in our journeys. So the one example I gave was the mental health. We also use it in physiotherapy as well to give patients feedback about how they can improve their stretches and exercises to improve their musculoskeletal conditions, but also from a back office perspective in terms of making the process of consuming their insurance pathways better. So we're using now AI to move from unstructured to structured data to improve that pre-authorization process. So both in the healthcare that they receive, but also in the way that they receive it and the processes behind it.
One topic that's come up already a few times is the issue of using AI responsibly.
Yeah.
And of course, being in the healthcare industry, you are privy to such extremely sensitive data about a person. And with that comes a huge responsibility to keep it safe. How do you ensure that? What steps how are you using technology to make sure that a patient's data is safe?
Safe, yeah. I think we heard from Kristen earlier. It's with great care and difficulty, but as you say, healthcare data is probably the most kind of privileged data you can have, and so we, as a insurer and a provider, need to make sure that the appropriate kind of barriers for information in the right places. So we've got good governance in that respect, but additionally, making sure that the data that we do receive is used to improve the health outcome of that individual. I think when people see that happening live, they naturally trust us with that data. And so I'm glad to say that with the appropriate governance in place, we do well with that.
Trust, you just mentioned that, and that's what I was going to come to next. Yes, you can keep data safe and you can have technology to ensure that. What's really important is building trust with your clients, right?
Yeah.
Talk to me about that, the challenge of really winning a patient's trust.
Yeah, and I think that all the way circles back to providing them to have value in our journeys that we provide. So if we can improve their health when they're sick, or even better, prevent them from getting unwell, and they see that in action, which is definitely our mission, which is to help people live longer, healthier, happier lives. If we're successful in that, and we have been, then it's a virtuous cycle. People trust us, they stay with us, and then the longer that people stay with us, the better we can help them in the long run. So that's really worked out well.
So here's something that I've been thinking about. When it comes to healthcare, yes, I want to have a healthcare provider that uses AI and technology to give me my results faster. At the same time, though quite often, I just want to see a human doctor.
Yeah.
AI can't replace that experience.
No, absolutely not, and I wouldn't want it to.
You don't want it to.
As a physician myself, that wouldn't be great. But absolutely not. I think artificial intelligence is there, in our eyes, to augment the patient journey, to augment the way in which the doctors or the clinicians provide their healthcare. If I give another example of things that we're looking at ambient artificial intelligence to see how that can increase the efficiency of a consultation. We know that our patients and customers like to converse with a physician face-to-face when they want to, but also they want the attention and the love and the care of that individual. And so it's important that we are able to improve efficiencies within things like consultations so that a physician isn't diverted to, say, typing a letter or having to do administrational tasks that they don't have to do. So we really believe in individuals in our workforce operating at the top of their license. And I think there is use cases in things like technology, transformation, and artificial intelligence to help that. And then subsequently, the patient journey is a lot better, and then they stay happy.
Another great question that's come in. How do you balance the risks versus rewards of using automation in helping or making clinical decisions as part of a patient's journey and not just for business operations?
Yeah. So, I mean, tricky question. But so if you look at...
We have a good audience.
Yeah. So if you look at the risks that... So artificial intelligence generally, from a physician's perspective, can you be used to aid the decision making. So you can see they use it in imaging, for example, in x-rays, but it always goes through that physical check. So it can increase the efficiency. And I understand the question in terms of not just for operations, but sometimes it is dual fold. So improving the business operations does in turn improve the health outcome, because you get more time between the interaction between the customer and the patient and the physician. And I think that's always going to be a good thing.
So let's put aside a patient's journey for a moment. Talk to me about how you're using technology to transform your business internally. Are you using it anyway to streamline process, to create efficiencies within the organization? I've read about digital outside and digital on the inside.
Yeah.
So tell us about that.
Yeah, so I think our focus has definitely been on the customer journey.
Yep.
So, but internally, we are looking at ways in which we could go through things, simple things first, like systems consolidation, to make sure that the data is transportable between organizations if a customer exits us or goes to another partner, if you will. So there is things that we're looking at and trying to improve that journey, which in turn helps us from an efficiency perspective internally as well. But the focus for us has definitely been on the customer journey to date.
There are so many levers you have to pull, changes you have to make within the company to, working with your physicians, for example, because everything changes. The way, the traditional way you've operated your company is changing. Another topic that just came up in the previous panel is the idea of the mindset. Is it hard to convince people to do things differently?
Yeah, I think it is all the time very difficult to change people's minds about the concepts of what they can, especially in healthcare. And doctors, again, I can say this as one, are generally very resistant to change. They think the way they've done it is always the way they should do. And I think that, again, I think that is changing. And I think, again, without going back to the pandemic, I think that was a catalyst for that. I remember attitudes towards virtual consulting were difficult even before, when we tried to introduce it. But when people couldn't work physically, then there was no better alternative, and then people became more accustomed to delivering healthcare virtually. So if you use that as an example, I think, yes, people are changing their minds to that. Doctors are, clinicians are, and I think that's a healthy way to look forward. But more importantly, I think it allows us to be able to provide virtual type of healthcare, whether that be through wearables or synchronous or asynchronous consultations, coupled into where the physical appointment is necessary. So it should be a fluid interchange. I don't think it can be one or the other.
Another great question. The insurance side of claims is becoming more automated. Could you walk through what your processes are used to ensure accurate claims approval and remove AI biases?
So our processes, we don't use AI to ensure whether the claim is accurate or not. What we do,
you just assume it's accurate. Yeah.
Well, there are checkpoints, yes, but we usually, we again trust us to work both ways. We do trust our customers to provide the right information. There is a heavy amount involved in that, as they do trust us with their information. So I think there's a bit of a trust exchange.
Both ways.
Well, yeah, exactly. But I can see a use case for that going forward. But generally, for us, we're focusing on the use of being able to automate the data so that we can at least action the pre-authorization a lot quicker. And that, again, improves the speed to access for someone to get healthcare. That's the way we're using it at the moment.
And there's a great part in this question about, remove AI biases. What, when you're working with all these algorithms, and especially in the healthcare industry, when you're working with people who come from such diverse backgrounds, racial groups, etc., how do you make sure that you've eliminated any bias?
So I don't think we've got there yet, is the fair answer, in terms of the fact that we haven't got. And I understand that the way that AI uses its data is based on what it already knows, and so therefore there's going to be a bias towards the information that it has and the generalizability of that. I think that's somewhere that we haven't really got that far yet. We're using it more in the therapy world, where there is no bias in terms of it's reacting to the individualized data that it has there on the spot. And then also in the processes of bringing things or claims quicker to action. So when we get there, I'll definitely consider this question and rewind back on here.
As Global Transformation Director, what are the metrics you apply when deciding, yes, I need to change this function, or yes, let's introduce this new change? What defines success for you?
So we're a very big organisation that operates in lots of different local markets. So, for example, the UK, Spain, Australia, where context changes. So rather than a very stick-like approach of this must be done here, we operate in a little bit more of a federated model where we react to customer need locally. So the KPIs around that are more around how can we improve the customer value, how can we improve the customer journey, how can we control more of the touch points so that we're doing the aforementioned and so on. And if those aren't working, then we have conversations and see how we can change those. But without getting too granular, I think that gives a good overhead view.
And I know you're right in the middle of the transformation process right now, but up until now, what's the one transformation that's been the trickiest to execute?
Yeah, that's a really good question. I think I would go back to people's cultural mentality towards using technology in healthcare. So
even after the pandemic?
Even after that, yeah. I think it's because the bulk of our workforce are clinical, especially in the delivery, except if you take ourselves away from the insurance businesses. And they're used to doing things the way they always have. And I think changing that cultural mindset has been a journey, and I still think that's part of it now.
I think we're going to end with a question from the audience. Is there anything you would or wouldn't like to see from the government or regulators that would help you achieve your transformation goals? So yes, what role can the government play? Can it help, or would you rather they just stayed out of it?
So I think co-creation of solutions in the AI space, and also with the regulators, because clearly there's a bit of catch-up to do from a regulation perspective. But I think working with the healthcare organisation in the ways in which it can be delivered and doing that together, coupled with the public system in the country like the UK, is crucial. I think together, if the three entities were to work together on that, I think we could very much achieve a lot of, solve a lot of problems that we have collectively.
And very quickly, if I asked you this question 5 years from now, describe Bupa.
Yeah.
How would it have changed?
I think it will have continued very much on the journey we are now, which is moving towards being a healthcare partner to an individual. It's not a funder, not a provider, but all the way through. And I think you will see us operating on different levels digitally, whether that be synchronously, asynchronously, using wearable devices to track information and provide appropriate care at the right time, having layered upon digital solutions on our virtual healthcare consultations, very much operating like other industries are in your back pockets, making sure that your clinician is with you at all times, and that you can get your claims quickly when you need to, and that you don't get disease sequelae, and we prevent you from getting chronic disease, and that's where I think we'll be.